Hello and welcome back to the Healthtech Pigeon podcast, where we break down the health tech news every single week. And today I am joined by Stephen McAdam from DNV. Stephen, thank you so much for joining us. How are you doing?
A little tired. It was a 2 o'clock start for me this morning because I was at WHX in Dubai, but doing very well. It's very nice to be here. Thanks very much.
Brilliant. Well, I mean, if that isn't dedication to the cause, stepping straight off a plane onto the Pigeon podcast, that is impressive stuff. So yeah, thank you so much. But how was WHX Tech? How did you find it?
Well, it was their inaugural event. It's kind of a
Mm-hmm.
split off from Arab Health. It was smaller, but that's can be a good thing. Walking around Arab Health, you can walk for kilometres before you find the kind of digital health companies. It was hotter because it was a different time of the year, but it was also really interesting. I mean, I think the atmosphere in the Middle East is they still have challenges in healthcare like everybody else, but they are incredible tech optimists and incredibly certain that they're going to solve the problems that they're faced using technology. So it was quite yeah, inspiring in that sense. There were a lot of interesting companies, and one of the things I noticed was there's quite a few companies looking at preventative care that were
Mm,
starting to emerge.
interesting. That seems to be a recurring theme.
Yeah, I'm not sure I've seen so many in other events, but
Mm,
there were 4 or 5 that I noticed that were, I think, trying to use the kind of insurance frameworks that there are and the insurers, payers in the Middle East to push along different kinds of wellness, preventative care
mm.
solutions. Um, which, yeah, it's interesting to see if they succeed.
Yeah, definitely. Because I think there's obviously been particularly with the 10-year plan over here, there's clearly much greater emphasis universally on preventative care. But I get the impression that over here in the NHS, particularly, we are a few steps, oh, well, probably steps is even further than that, a little way away from really achieving preventative care. I think it's often seen to be more in the domain of like consumer health, rather than a public health system. So it's interesting to see that sort of difference in perspective over there in the Middle East, where it's being done and addressed right now as a focal part of maybe how they approach healthcare.
Yeah, I mean, I think we've talked about preventative care for decades, but it's remained stubbornly within the health
Mm,
system around 3 or 4% of spend
mm,
um, all across OECD countries. But in the Middle East, maybe they have an ability to push that onto the agenda of, for example, corporate programs and things like that, or through the payers.
well, it sounds like it was a good event and definitely something that was needed. Perhaps if that emphasis on technology, if you're getting lost at Arab Health and having to get those steps in, having something that's a bit more technology focused means the conversations are focused, and the opportunities maybe a bit bigger. So that's awesome. And as I say, thank you so much for the dedication to being here and talking about our news today.
You're welcome.
All right. Well, let's get into our news. The story that I want to chat about today is the BMJ Commission. So the BMJ Commission has just released a report, and it's talking about just how close or not we might be to really realizing the benefits of digital health. So this is a report that has been launched in collaboration with the BMJ Future Health and also DMV, and it has surveyed 300 healthcare professionals from across Northern Europe to get their perception on how digital health transformation is going across health systems and countries, and to understand where the barriers are, where the barriers remain, and what is it that we still need to do to really make sure that we are creating impact with the technologies that we are bringing into health systems. So, Stephen, why don't you just give us a download on what that report tells us?
Yeah, thanks very much. I mean, the background, as you point out to the report, is that I mean we work in many countries, and I think there's a recognition now in almost all countries that healthcare is no longer sustainable and there needs to be real changes. And everyone is talking about, well, the digital transformation is what's going to rescue health systems. And so we wanted to ask the question, well, if that's the case, what's the experience so far that healthcare professionals have with digital technologies? Um, and what we found, I think, is probably confirms a lot of what we thought, but it's also
Mm.
some things which are somewhat worrying in a sense, and maybe make us think about how we need to move forward in the future. So the positives were that, I think over 80% of healthcare professionals found that digital technologies were improving the kind of quality of care that they were delivering. They were improving, not surprisingly, the kind of data access they're getting around patients. But when we're looking and asking questions about whether digital technologies are improving or reducing the clinical workload or reducing the amount of administrative tasks, those numbers drop right down. So, this idea that we're going to bring in digital technologies to help us deliver more care with less resources is not necessarily backed up by these findings, but not least in terms of the experience that the healthcare professionals have.
Mm.
They're more saying that, yeah, it's improving care, but in some senses, it's making things more cumbersome and requires more time.
It's interesting, isn't it? Because, you've got on one hand healthcare professionals, 76%, so that's three quarters, saying just how optimistic they feel about, the future of that. And that's in spite of the fact that actually the benefits are kind of yet to be realized. And one of the things that really stood out to me was um, how how much experience with EHRs influences people's perception of the benefit and the opportunity with digital health. Um, what was your take on that? Because again, EHRs are one of the most significant technologies that people are going to be getting their hands on in the healthcare space, isn't it?
My feeling is that EHRs are foundational. They're the one system that everybody looks to, and that I think in most countries we've pretty well rolled out, but not necessarily very well. And I think what the report found was that those people who used EHRs regularly had less confidence that digital technologies would help them in the future. Um, so I think one of the findings that we felt is that people really need to focus on delivering a good electronic health record if they're going to manage to build the support from the clinicians working in the hospitals for the adoption of future technologies.
And in terms of, I guess, it, how we appraise technologies as well. So, like you said there about finding a good EHR system, um, one of the things that this report recommends is bringing healthcare professionals more into decision making around the types of technologies that are being used, and in those investment decisions and that kind of thing. But do you think that it clearly perhaps that there's a disconnect between what it is that healthcare professionals need day to day from a technology and what they're receiving? Where do you think that kind of friction is? Is it to do with just from a system level, it's not providing what they need, or there's a user experience gap, or where do you think the where do you think the friction is?
I think there could be multiple reasons for this. It's a complex area. I mean, one of the areas that was clear is that interoperability is a real challenge, and with systems not talking to each other, with healthcare professionals having to log in and out of different systems, whether it's different EHR systems or different systems that should be talking or being opened up from within the EHR. It's clear that that's still causing a tremendous amount of frustration, and I can understand that. But again, this is the feedback from the users, and some of the frustrations can be because there's a real need to collect structured data, and the
Mm,
benefits for doing that are felt elsewhere.
mm,
Um, and again, maybe that's an area where agentic technologies and things like that will start to help in terms of collecting that data in a less painful way.
Mm. It's a really good point, actually, isn't it? Because often, you know, because of the siloed nature of the way that health systems work, often, you know, it could be a technology, it could be any kind of intervention or approach or improvement, that can be implemented in one place, but the benefit might not be felt where it's being implemented. And I guess that can cause tensions as well, because if it's particularly where you have these different funding pots, even within the same organizations, different budgets, where you have uh, one part of an organization paying for a technology, but the cost efficiency isn't being realized in that particular space. It's being realized somewhere else in the organization. And I guess that must create tensions as well. And I think that is an important part of interoperability that is sometimes overlooked, because you want to feel the benefit when you're using something. If it's making your life harder, you don't like you don't really care if it's making something else easier for somebody else. It's really tricky, isn't it?
Yeah, and it might not even be in the same organization. It may be in
Yeah.
other organizations where the benefits are realized, so
Mm.
yeah. But I
Yeah.
think, user experience is clearly an area where there needs to be improvements,
Mm.
based on this study.
How do you think, or do you have any thoughts based on, some of the recommendations the report has put forward around what should be done in order to bring healthcare professionals into, maybe it's procurement decision making, but also maybe even, some of those decisions around how systems are built and then implemented. How can we tackle some of that as a challenge in practice?
Yeah, I think there's there's no doubt that clinicians need to be involved in the whole process, from designing, procuring, and also the training that's involved in rolling out some of these systems. There is a challenge that then clinicians need to be given time to be doing that, and I think there's a tension there. So I think there's an issue of leadership there to make sure that there is funding available, so this isn't just something that's done on top of normal work that clinicians are having to do.
Yeah, I think so. And I think, that speaks to the wider tensions in the health system already, doesn't it? Where you have, you know, waiting lists, everyone's talking about waiting lists, and how, that is a huge issue. They're talking about uh, under resourcing of a health system. There's not enough people to do all the work. And then at the same time, you know, we're looking at how do we create more time in healthcare professionals' days so that that time can be invested so they can onboard and they can then provide better care. And there doesn't seem to be a clear cut answer to that, because that it's you can't rob Peter to pay Paul. There's not enough of one to be able to do the other, and so it often feels like it's just another thing to add to the list of things to do, which already doesn't feel good to people. So even if the training is being provided and it's good training, I know that if I'm already feeling stretched and overstressed and I've got a lot of things on my plate to do, and it becomes a burden. So my psychological mindset as I go into that is not a positive one. I'm probably not going to get the most out of it. So I can imagine that has a influence as well, because you know people are just doing their best.
Yeah, I agree. And there's no simple answer to this. Again, it comes down to an acceptance that there needs to be an investment if you're going to be using digital technologies, and it's not just in the technology; it's in the processes and the people. And along the whole way, we need to make sure that the healthcare professionals working at the front line need to be involved in that.
Yeah, definitely. I want to talk about trust as well. I think trust is something that always comes up when we talk about any kind of change and transformation in healthcare, and ultimately trust as cornerstone and foundation of healthcare in and of itself. And I'm keen to kind of get your view on, you know, because the stats of this survey were really interesting around trust, which is that 59%, that's nearly 60% of the healthcare professionals surveyed, said that they do actively trust the technology solutions that they're using. And that's in spite of what we've already talked about with experiences of EHRs and that kind of thing. But I think, 60% is not to be sniffed at, but let's not forget that that actually leaves another 41 in this case, 41% of people who don't have that trust, who are still feeling hesitant and doubtful. And to me, I think it's really easy it's great that 60% of people do, but I think, I think that those statistics in and of itself show that there is still some way to go in terms of closing that gap to be able to really um, allow the clinicians but the systems themselves to feel the benefit of the digital transformation and really be able to have confidence in the adoption of them. So what's your view on trust as this kind of currency for digital health?
So I think those figures are, for me, they're quite scary. Um, I mean, it's great that 60% are saying, or 59% are saying that they trust their technologies. But in any other safety critical industry, to saying that 4 out of 10 people aren't confident with the technology they're using or the data that's being used within it, I think is rather scary. Um, and I think we need to work on trust in a number of different levels. There's the basic trust that you get from using good standards, good technology, so that you know that the technology is likely to work and that the data is going to be of good quality. But then there's the operational trust that you need to build by having good programs for rolling it out, for involving people in the development and the deployment of the technology, and the training and the follow up, and making sure that the system, so people can call for help and get help when they need it. So I think it's multiple levels, but I think there's a real issue here. If 4 out of 10 people in a department don't trust the data, don't trust the technologies they're using, they're going to start not pushing for it to be used. They're going to be finding workarounds, or they're going to be checking up on the data. It was one of the things we heard in some of the interviews, that people needed to check up on the data before they trusted it. That's not leading to increased efficiencies.
No, definitely not.
And
Definitely
you,
not. And
and in a way, you can say it's really great that healthcare professionals are so diligent that they're checking data in a second system before they're trusting it. But at the same time, it's a recipe for disaster. It's going to be inefficient, and it's going to lead to errors.
definitely. And I think another story that is in Pigeon this week is Department of Health and Social Care have announced a reduction in annual spending on data infrastructure by 12.6 million, which is not an insignificant sum of money. And I think something like that is also going to really contribute to undermining trust, not just in technologies but in the system and in the decision makers, the people who are responsible for allocating the budgets and making decisions about operational and commercial decisions about how these healthcare organizations are being run. And I can imagine seeing something like that when you're already, as you say, maybe even checking multiple systems to be sure that data is correct is a bit of a kick in the teeth.
Yeah, I mean, I've been, as I say, away this week, so I haven't followed what's been going on in the UK. But you would think, given the focus of the 10-year, given the focus of the 10-year plan and all the talk around switching from analog to digital, and the real focus on investing in data and infrastructure, that that they wouldn't be looking at cutting funding for data and infrastructure in this year of all years.
Yeah, it does just feel at odds with as you say, with the 10-year plan and those big ambitions. And I suppose with the 10-year plan, as a lot of people will say, we're yet to see um we're yet to see the detail behind that ambition in terms of how they anticipate rolling that out. But that doesn't really give us much of a positive signal, especially when we know, and this is really your domain, that data is such a crucial part of uh, that trust, that reliability, security, safety of the technology itself. Data is a really core pillar to all of that. And so I think it feels, on the face of it, it looks like a bit of a rug pull. I'm sure there's maybe some bigger plan that perhaps hasn't been communicated with us, but I think you can't underplay the role that data plays in making sure that uh, the system and the clinician's experience of technology is a positive one, and that they can provide better care to patients.
Well, I mean, as I say, I just came back from Dubai, but any conference you go to and all you hear about is AI, and AI
Mm,
is dependent on good quality data
mm,
that's accessible. So it's a very strange time to be reducing funding for that. But
yeah.
again, maybe it's part of a larger great plan.
Yeah, maybe it is, and they haven't let us into the circle of trust on that one. Building on use of data and just how important that is in healthcare infrastructure. There's also been another big announcement for DNV this week. So why don't you tell us about that?
Yeah, it's very exciting. We've announced this week that we've invested in Patients Know Best in PKB. Um, it's a company that we've actually been following for years, mainly because we just believe that it's right to give patients access to their own data, but also because they've been doing some very exciting work both in the UK, but also further afield in places like the Netherlands, Germany, and even Nigeria in Lagos. So we see that they're a kind of really values-based and driven organization. They're very well aligned to the kind of foundation-owned and purpose-driven organization DNV is. And they're doing really exciting stuff with data, empowering the patient, uh, and empowering the patient in a ways that helps the patients, but also reduces the cost to healthcare themselves, the healthcare providers.
Yeah, that's awesome. And we know Mo really well. We're big fans of PKB and the team over there. And as you say, they're doing phenomenal things, I think, putting patients in the driving seat with their own data in a way that, again, there's been so much friction around. And they've really sort of pioneered that space. But I'm really keen to understand then. So you say that DMV have invested in PKB. Tell me a bit more about what you're doing as an organisation and your role, kind of in the healthcare space, and from that investment perspective, but also some of the other things that you specialise in.
We're a risk management and assurance company, which is not the most exciting thing to say when you're in a lift, but it's actually a very exciting company. So we're owned by a foundation. We're driven by our purpose of safeguarding life, property, and the environment, and we've been working in safety critical industries for hundreds of years, well, since 1864. In healthcare, we've traditionally been doing a lot of the kind of accreditation certification work. Um, and because it's healthcare, every country will have a different need and a different way of solving the same problem. So we will be doing accreditation or certification on we're using different standards very often to address the same kind of problems. So, for example, in the US, we accredit hospitals based on our own standards, but with recognized by Medicare and Medicaid, so it's essentially accredited by them to do the work of an accreditor. In other countries like Brazil, we'll be using the Brazilian national standards, or in the Netherlands, we'll be using national standards that have evolved from ISO. So we're doing a lot of that kind of work. We're also a notified body in Germany and uh, and Norway, but the work that the digital health group has been doing is in a way trying to almost um, challenge ourselves. We believe that the way that assurance will be delivered in the future will be more and more data driven. It will be more and more focused on data. Um, And so we decided to build up a portfolio of digital health investments, um, both being everything from kind of startup venture investments. So we invested earlier this year in Newton's Tree, which is an AI assurance platform for hospitals at an enterprise level. Um, to majority investments where we bought a majority stake in MBI Health that works with data quality and patient waiting lists in the NHS. And I think what brings them all together is we have a focus on three areas. It's either data security, data cyber security, information security. It's data quality and data integrity, or it's interoperability. And I think PKB kind of is a really interesting organization because it's all about data sharing. And once you've empowered the patient and you've got the consent of the patient, it opens up for sharing data in a way that we see that healthcare organizations just continually struggle with, whether it's genome centers in Denmark or hospital primary care systems in Norway. The issue of GDPR and how you manage the information governance is just still seems to be so challenging. And there are ways around it, but it seems that if you just accept that you give the power to the patient and use their consent, that makes things so much more simple.
That's awesome. I had no idea that kind of your portfolio was so extensive. I knew obviously about the risk piece, and I think, you know, that is often maybe perhaps what DNV is known for. But you have such breadth around what it is that you're doing and your interface, I guess, into the industry that yeah, I think that's really phenomenal. And you're working with some really interesting companies, from Newton's Tree, MBI, and now PKB as well. And so does that sort of set the tone for the ambition for the next couple of years and how you will be kind of moving forward as an organization and collaborating into the industry?
Yeah, I mean, our ambitions are high, so we will continue to invest both in ventures, but also in majority investments. I mean, part of what we're trying to build is a kind of European competence around digital health. So not just in one country. I mean, typically, many of these digital health companies may succeed in their home market, and then the barrier to move into a neighboring geography, whether it's the Nordics, Germany, France, Spain, is really quite challenging. So one of the first company we bought was DNV Martis. We've experienced how difficult it is to get them to move into additional geographical markets, but they're now starting to succeed. For example, partly through the competence we have with MBI Health and the understanding that gives us with NHS. DNV Martis is now starting to break into the NHS, and they've had a tremendously successful pilot, for example, in Cornwall, where they created a silent hospital using their technology that allows communication and task management using mobile phones. So yeah, we look to be investing in more and more companies. And we look to be supporting them to scale, while we won't be integrating them tightly into DNV, so that we'll allow them the agility and flexibility, but we'll be able to provide some of the kind of corporate advantages that a company like DNV can give them.
Hmm. Do you say a silent hospital?
Yeah.
Tell me more about what that means.
So it's quite interesting in a way because DNV and Martis originally 40 years ago, 30 years ago, came from a data platform that was being used in the North Sea, Norwegian company. But they then applied that to a hospital that was being built in Trondheim. And essentially, what they've done is they've built a data platform on top of the legacy systems in a hospital. And it draws the data up so that the data that's relevant for patients at the hospital in any one day is available in real time. And then there's there's apps that lie on top of that, and also a low code, no code platform that allows healthcare professionals to create, whether it's whiteboards or apps for example, taking blood or delivering medicines. But it's integrated in huge number of systems that the hospital has, everything from the electronic health record to the building management systems, the lifts, the computers, sorry, the robots that they have in some of the hospitals in Norway. Um, and this means that we hadn't really reflected on it because it's just normal in Norway, but it means that the hospitals don't have alarms going off. If you call a nurse call, it doesn't send an alarm, it sends a message to the nurse who's on call or has that patient as responsible. And if that nurse doesn't respond, then it's moved on to the next patient, the next nurse. So when we went to Cornwall and started talking about what we could do, they came to visit some of the Norwegian hospitals and they said, "But everything's silent, everything's quiet, it's relaxed. That's what we want in our hospital." So although the technology is the same and the use case is essentially the same, one of the benefits that they really saw was that it just reduced the noise in in the in the department that it was being used in and piloted in. And they've done analysis at that hospital and shown that it's created huge savings because it also benefits the patients being in a quiet and relaxed atmosphere.
Wow. That's so cool because you're absolutely right. Hospitals are not relaxing places at the best of times, and there are bleeps and noises and buzzing and all sorts of things going on. And I think it reminds me of, we talk about holistic care a lot, and like all of the different factors that contribute to good health and also a good experience of healthcare. And I sometimes feel that hospitals aren't necessarily built around that. I think maybe that in part comes from other, that our NHS legacy over here in the UK. But and so we're layering technology on top of things and systems on systems on systems. But actually, sometimes what's needed is to kind of pull everything back and then redesign something from scratch. So if we were designing a hospital today, it would probably look entirely different to how hospitals actually look and how they operate, because we would factor in so many of these different things that make the experience more positive for everybody on these numerous different levels, not just in terms of the transactional care that they're receiving.
Yeah, I mean, if you travel to some hospitals, and admittedly, these are some of the hospitals in Asia, for example, that are private hospitals. They've designed them around the same concept as hotels, so you've got front corridors and back corridors, and the care is designed so that you don't wait. It's the doctor that's waiting for you to come. Now, that's probably not relevant for a public hospital in Europe, but it is worth thinking about. Could we step back and think a little more radically about how we design the hospitals for the needs of the patient?
Yeah. I think actually I was talking to someone quite recently and they were telling me about it's in it's in Australia. There's a primary care group who have set up a series of practices, and it's very much on that ethos where um, when you go in as a patient for a consultation, you go into a consultation room, but that consultation room is yours. And so everyone moves around you. So where you see multiple people, they all come to see you in the same room, rather than you being kind of ferried around to different places to meet the healthcare professional. And then, so that in a really practical sense, that really does put the patient at the center of their care. And yeah, you feel more important, I think, when I guess you're not having to be kind of pushed from pillar to post, and everything you need is being brought to you, and it does have that sort of hotel vibe, doesn't it? It's
Mm,
like, delivering that service. And um yeah, I can just imagine that reducing stress so much.
yeah, maybe it's something for the new neighbourhood community centres, but
Well, as I said, we are still waiting for the detail behind those lofty ambitions of the 10-year plan to reveal themselves, and maybe it'll be in there. And if it's not, perhaps some of those people might be listening, and they could slip it in, and make sure that that's something that we see, as all of the plan rolls out and comes to fruition. But awesome. This has been such a good conversation. And as I said, I had no idea just how many things you as an organization did. You're a notified body as well, massive from a regulation perspective. And so we talk a lot on here about regulation and just how important that is, and how challenging that can be for healthcare innovation. So, phenomenal that, we have organizations that can support that, and see, I guess, the entire ecosystem, and are able to serve it in so many different ways. So thank you so much for joining us. I think we will let you go and sleep now, and recover from your travels, from your trip, and yeah, thank you so much for providing your insight today.
Thanks very much, Jessica. It's been a real pleasure.